For this video, I'm going to be discussing the rationale for using urinalysis during pregnancy. Basically, urine is an excellent way to check for many pathologies or just abnormalities that can happen during pregnancy. Dipsticks have a panel that can test for different things. I did discuss this with my preceptor, and she says that we don't routinely do dipstick urinalysis during clinicals for whatever reason, mostly because it's not used itself as a diagnostic tool. It is a screening. However, I would have to be under the mindset that, like, even if it's not a diagnostic test, it's an excellent screening tool, and if we do get an alarming result from the screen, like say white blood cell counts are high, we can send it to the lab to culture it. So I'm talking primarily in case of a UTI. So pregnant women or pregnant people are more prone to UTIs, and they can be asymptomatic. The problem with asymptomatic UTIs is it can go to your kidneys really quickly. So we want to be able to get those diagnosed and treated as soon as possible. So for me, I think it's a pretty non-invasive test. You can just, pee in a cup, see if there's you can look at it visually and see, like, okay, does this look cloudy? Does it look amber colored? Is it light and clear? Like, how does it look visually? So if it is cloudy or there's like a lot of sediment, like, we do want to test that. When you are testing it with the dipstick, you're going to want to pay attention for those white blood cells and other indications of an infection. Let's see if I'm forgetting anything. So those are the visual observations. If we're getting something that is like screened as outside normal limits, we can send it to a lab, and there they will take the urine and culture it. And so with the culture, if it grows like a bacteria, yes, it's looking like the client is having a UTI. Second to blood, urine and blood are our best ways to gather information on what's going inside the body. So I will probably use urine analysis, or at least a urine dipstick, at every prenatal appointment.